I'm Lindy from Spirit of Eureka. Like me, all our speakers are from the Sydney Basin tonight. Here there are many clans: Gweagal, Gadigal, Darrick, Carrigal, Camaragal, Bidjigal and many more. We acknowledge and pay respect to the unceded sovereignty and custodianship of their elders from the past, the present and into the future at this, the very first point of invasion, but also of organised, ongoing resistance. These clans were the very first peoples to face epidemic on this continent and its island, murderous smallpox, knowingly brought by the British invaders. Decimated, clans gathered, regrouped, survived, resisted. A process that played out again and again and again across the lands. We pay respect to this history, to any Aboriginal peoples present this evening in whom this history is embedded, to all those first peoples and their elders on whose lands you listen, watch and ask questions tonight. Always was, always will be Aboriginal land. We have three speakers from southwestern Sydney tonight, 2 nurses and a teacher, and there'll be plenty of time for questions after they finish. At the end of the meeting, we'll be publicly launching the open letter that many of you have already signed. Any questions for our speakers, please write them in your chat. Keep yourself on mute. And I'm just letting you know that we're recording for them, so if you wish to turn off your camera, please do so. And I'll right away start with Heidi. Heidi's worked for a decade or more in southwestern Sydney hospitals, and she's currently an organiser for the New South Wales Nurses and Midwives Association. After her, we'll have Mira, who's from a COVID ward in Sydney. And we'll also hear a report from the emergency department, what it's like a day in the life. Thanks.
Hi everyone, thanks for joining us and allowing us to speak. So my name is Heidi Mcmurray and as Lindy said, I am a registered nurse and an organiser for the New South Wales Nurses and Midwives Association. I worked for New South Wales Health in the southwestern Sydney LHD for over 10 years, and I was there when the COVID pandemic began. But before I share a story from an emergency department nurse in a busy COVID hospital, I'll just tell you a bit about ratios, because you hear that a lot from nurses and midwives and not everyone really knows what it means, but briefly I'll let you know. So we've been fighting for safe nurse to patient ratios for over a decade now, and even with evidence-based research that proves ratios save lives and even saves taxpayers money, the government continues to ignore our plea and refuses safe nurse to patient ratios. Without getting too in-depth, ratios are adjusted to specific departments, but the most common need is 1 nurse or midwife to 4 patients on the ward, or 1 nurse to 3 patients in ED. So our common chant is 1 to 4 on the floor, 1 to 3 in ED. Our government also does not count babies as numbers, so midwives may be given 6 new mums to care for, and excluding multiple births, they really have 12 patients, but apparently the babies are not a patient number, so this is acceptable. This pandemic has shown us just how badly the lack of ratios has impacted the nursing workforce, a workforce that was already understaffed and exhausted pre-COVID, and we know as cases rise, it will only get worse. The care required on a COVID ward needs to be almost doubled to ensure the safety of staff and to provide adequate care for our patients. This is not being seen in New South Wales. The amount of nurses and doctors it takes to intubate or ventilate a COVID patient is usually a minimum of 5. Ventilation is also a highly skilled specialty, so not every emergency department nurse is trained to intubate. Keep that in mind when Hazzard claims there are plenty of ICU beds, as the question is, are there unlimited numbers of ventilator-trained staff? It would also be... Sorry? Was someone else? I'll keep going. It would also be... Did you want me to keep going? Yeah.
Uh, Sorry to interrupt, but John Dempsey is not muted. We need to tell him. John, could you mute, please? He has now.
Muted now.
Oh, cool. I'll keep going. It would also be extremely helpful if the government could spend more time on educating the public about the real challenges in public hospitals during COVID. We understand it is more difficult to see a GP at the moment. However, presenting to an emergency department with non-life-threatening conditions such as a rash you've had on and off for 2 years or an upset tummy could have you waiting long hours in the waiting room with potential COVID positives. Hospitals do not have the resources to isolate each individual, so the potential for exposure in waiting rooms is a definite risk. Also, they could highlight the need to be more cautious with our health. Do not partake in risky behaviours and drive sensibly. If you break a leg doing a TikTok challenge, you may end up in a surgical ward. It only takes one patient to test positive and that ward is now in COVID lockdown with you in it. Or if you have a car accident and end up in ICU, you may be surrounded by COVID positive patients. The public need education and transparency from our government in order to know how to support the public healthcare system during this pandemic. Before I read you a nurse's story, can I just let you know about my abbreviations, because nurses are really bad with it. So ED stands for Emergency Department. PPE is personal protective equipment, and during COVID that involves our nurses and midwives to wear full gowns, gloves, fitted airborne mask and a face visor or goggles the entire time you're working on the floor. Then we have fit testing. This is when healthcare staff are properly fitted by a machine for the appropriate airborne precautions mask for their face shape and size to adequately protect themselves and the public, as not everyone suits a standard N95 or P2 mask. So fit testing is extremely important for work health and safety and protecting the public. But alarmingly, there are still an unacceptable amount of healthcare staff not fit tested, even though New South Wales Health and private hospitals have had well over 12 months to do this. So now I'll give you a day in the life of an ED nurse in a very busy COVID hospital. It's been a hard shift. It's always a hard shift now. So many COVID cases, so many critically ill people, and not just the elderly. The waiting room is overflowing as usual, and I hear the ward clerks being abused from angry patients waiting to be seen. I've been abused and threatened by angry patients needing care and aggressive visitors who have been asked to please remain in the waiting room while we care for their loved ones more times than I can count today. This is not unusual, but unfortunately violence towards nurses has increased since COVID hospitals restrictions, and although we understand people's fear, frustration and confusion, we are tired of being pushed, hit, punched, kicked, yelled at and spat on for doing our job. I spoke with a paramedic who has also been abused and attacked while wearing his full PPE and still expected to treat, bring to hospital and then sanitise his ambulance and equipment as fast as possible to make a quick turnaround and get back on the road. So far today, I've performed CPR twice in full PPE. Under my gown, my sweat disappears quickly as I'm always dehydrated from the PPE. I have comforted distraught families who have lost loved ones but could not be at their bedside to hold their hands, comfort them and say their goodbyes because of COVID. I hope they can see the empathy in my eyes through my full face visor, as this is all they can see of me. I have to comfort the terrified mother of a teenager receiving CPR in resus as she cannot be at his side. I want to hug her, but I can't because of COVID. I pray he makes it. I must ensure I notice the slightest deterioration in my COVID patients as they go downhill so fast and we will need an ICU bed ready. I can't forget my other critically ill patients, as ED presentations do not stop for COVID. I need to protect my clean patients from contracting COVID. My elderly dementia patient from a nursing home does not understand why she must wear her mask and continually rips it off and wanders the ED, unknowingly endangering herself to exposure. She also attempts to rip my PPE off whenever I'm providing patient care. I need an extra nurse to one-to-one special her, but that's not in the staffing allocation. She's confused and terrified and she can have no family at her bedside because of COVID. My patients need me now more than ever, and I know they appreciate and value me. It's disappointing my employer does not. It's disappointing the government does not. It's disappointing we don't have safe nurse-to-patient ratios, a dangerous ongoing problem that has just been exacerbated by the impact that COVID admissions has had on the public healthcare system. And it's downright insulting how the Health Minister continues to advise the public that public hospital nurses are coping just fine. There are plenty of beds, there are enough ICU beds and ventilated beds, and there's no need to worry. Is he positive there will be enough qualified specialty nurses to staff these beds? Because I am not. Morale is so low that nurses are leaving the profession. Good, honest, hardworking, experienced and much needed nurses who just can't take these poor working conditions anymore. And I fear the suicide rate for healthcare workers will increase alarmingly, as it has already done so within the public. Yet the Health Minister will tell you, we are fine. We are not fine. We are burning out. We are understaffed, overworked, exhausted, and most of all, we are scared. With growing positive case numbers and admissions, we are scared for our community. We are scared for what we may take home with us. We are scared for our colleagues who are in isolation with COVID. We are scared for our colleagues that haven't been fit tested. As COVID impacts remote communities, we are scared for our Indigenous people. We are scared for our remote and rural cousins who do not have the resources that metro hospitals do. We are scared of what may happen in our ICUs and COVID wards if we have no more beds, and we are scared what will happen if there isn't enough nurses to continue fighting this pandemic and saving lives. I've had my full PPE on for 6 hours now and hoping to get a quick break soon. I haven't had a drink yet, let alone any food, and I haven't had time to pee either. Wearing full COVID PPE for long periods has caused pressure areas on my face from my mask. My skin is dry and breaking out, and I'm constantly dehydrated. But I will continue working like this because my community needs me. I am a nurse, but I tell you, when you're on your 6th hour wearing that gear and your 4th intubation of the day, and you hear the ambulance phone ring with your next intubation, you have to take a deep breath or you will have a major panic attack. That's not coping, that's PTSD in the making, and to be told you're coping is tone deaf, ignorant, and damn right offensive. I stayed back an hour tonight as another patient had a cardiac arrest just as I finished my shift and needed CPR. I finally leave my ED, too exhausted to request that hour in overtime, too exhausted to realise I missed my breaks and my nose and cheeks are red raw from my mask. I live in an LGA of concern, so I go directly home to my apartment where I live alone. I cannot debrief with my colleagues at the local pub or coffee shop, and I worry about their mental health and how they are coping. I enter a dark and empty apartment and there is no one there I can cry to about my day. No one to run me a bath or pour me a glass of wine, and no one there to give me a much needed hug. I have no energy to think about my own mental health as I am just exhausted. So I put my contaminated uniform into wash, I have a shower and go to bed. After all, I have to get up in 5 hours and go and do it all again. Thank you for listening to my story. That was from an ED nurse. And I'll now hand you over to Mira, who works on a COVID ward.
Thanks, Heidi. Hi, guys. So I'm Mira. I'm a nurse and a New South Wales NMA delegate. That I work in a major hospital in an LGA of concern and a COVID hotspot. My ward is a COVID ward like numerous other wards have now become in my facility. The Delta strain has hit hard and hit fast and has been devastating to witness and exhausting to fight as a COVID ward nurse. Nurses are run off their feet, even more with COVID admissions, and desperately need mandated nurse to patient ratios. People of all ages, genders, nationalities, faiths and cultures are admitted daily. As soon as a bed is empty and cleaned, a very ill COVID patient is transferred into it. Our COVID patients are extremely ill and extremely afraid. They have no visitors whatsoever, and they can only see the eyes of their very busy nurses through our eye protection and full face visors. We try our hardest to spend that much needed supportive one-on-one time with our patients and reassure them, but it's just so hard and so hectic, there is no time. Many COVID patients have something in common. They are not vaccinated. Regardless if it was their personal choice or delays in accessing the vaccine, it's a major concern. Another thing they have in common is fear. Delta is not just killing the elderly and the vulnerable, and many patients will develop lifelong lung conditions even after recovery. Prior to becoming a COVID ward nurse, I personally volunteered to be COVID ward trained in case my ward transitioned. This is new territory for many nurses and can be overwhelming, and I took that training back to my ward to share my knowledge and educate my sisters and brothers so we could be better prepared to care for our COVID patients the best that we can. I often think of my colleagues in other wards who are working short-staffed every shift. I worry about the patients, I worry about our families, I worry about the healthcare staff who contracted COVID while doing their job and are in isolation. I worry that the nurses are going to burn out before this pandemic is over, and I worry about the workload of if hospital admissions continue to rise. But this is what we do as nurses. We keep on keeping on. We are told that we are trained for this. I don't remember training for a pandemic at university, but I stepped up to the challenge and I'll keep caring for my community, but I am tired. Mentally and physically, I am tired. We are told we are coping well. I wish our government would ask us, the frontline COVID nurses, if we were coping instead of just speaking for us. I've worked too many overtime shifts lately and my patients and colleagues see more of me than my husband and my children do. They understand that mum is a nurse and that this pandemic but they don't know how much I miss them, how overwhelming caring for patients in a pandemic is, how I miss breaks, how I can't hydrate regularly, oh my God, and how not having the time to use the bathroom impacts on a person, and how emotionally and physically drained I am. Jeez. And I will not burden them with this, as these are nurse problems and our cross to bear, but we are tired. We will always be there for our patients, but we are just extremely tired. Thanks, guys.
Thanks, Mira. And I know it gets, I get emotional. I was getting emotional reading the ED nurse story. It's all good. Just quickly before we go on, with our main struggle is ratios. If we had had ratios in place, we wouldn't have been impacted this bad with COVID. As I said, we'll continue to fight it. We've been a bit quiet with it at the moment, especially from the union and that, because we've been dealing with so many issues from COVID and our staff that are, you know, just so many things going on. But I'm going to I'll just put a link in the chat that will take you to a ratios page. If anyone ever wants to jump on, sign up, support it. When anything comes, when ratios is up and happening and that, it'll give you the info on it just to give the nurses the support, because we're going to keep fighting the government for them. But thanks a lot for listening to us, everybody.
Thank you a great deal, Heidi and Mira. Just asking people to, if there's anything you want to ask, please put it in the chat. We've got plenty of time for questions later. In fact, everybody, you could see that our speakers were kind of squeezing things into a short amount of time, I guess, and really pushing out that information. If there's anything you want to ask about, please write some questions in the chat. Our next speaker is Andrew Villa, who I know pretty well. He's a teacher and a resident of Fairfield. Over to you, Andrew.
Thanks, Lindy. I guess before I start, I just want to say I'm quite humbled by what I heard from our healthcare. I feel like I'm still being heard.
See if we can get a stronger signal, Andrew.
Okay, how are we going now? Is that a bit better?
That's much better.
Yeah, you've all come back to life for me, which is great. Look, yeah, I just wanted to start off by saying I'm truly humbled by what we've just heard, and it's really hard, I think, to speak with any sort of confidence after that, because it's truly the front line. And I guess everything I say, I want to contextualise by recognising the hard work that's being done to protect our communities.
We'll just wait for a bit.
I'm not sure if I'm being heard.
Are you back there, Andrew? We lost you for a bit.
Yeah, I'll try and turn off the video and see if that helps. Okay, how are we going there? Can I be heard?
Yep. Maybe move a little bit closer to the microphone, mate.
Okay. So, look, I want to start by saying that I'm speaking on Darug land. I'm a resident of Fairfield, born and bred, and continue to live here. I work as a high school teacher in the neighbouring suburb, which is about 6 kilometres away from my house, but outside of my 5 kilometre radius, which I'm not allowed to attend without a permit from the state government. I guess I speak initially as a resident of Fairfield purely by the fact that our community was singled out. We were singled out early in the lockdown and pandemic response. And we were particularly singled out, I think, as and labelled by the state government as a non-compliant community. And that's deeply problematic. And I think that that needs to be explored somewhat. Fairfield is a community where 60% of the community are born overseas. 20% of the community have education which is equivalent to year 9 or lower. We are perennially twice the unemployment rate of the national average. And 40% of the residents of Fairfield are tradies or labourers. The restrictions that were put upon this community early on in the lockdown hit hard, hit very hard. Rather than a health response, this community received a policing and authoritarian response. A day after the announcement that we'd had very special treatment in Fairfield, police were on our streets in numbers that I've never seen before. And growing up here, I'm quite used to seeing a very particular form of policing that we experience that I don't think necessarily is experienced by the rest of this city. However, I'd never seen police horses riding down the main street of Fairfield. I'd never seen the police chopper hover all day, all night, from 5:30 in the morning till 12:30 a.m., shaking our house. Who knows what they're looking for? I'd never seen drones, unmanned vehicles flying overhead and acts as surveillance. I'd never seen highway patrols snaking through suburban streets. And it made me question what this response was ultimately going to be about. I thought we were in a health crisis. However, what we were being presented with was a total overbearing, repressive state apparatus. The irony of all of that is, on the 29th of May, the ABC reported a 9-month study that had undertaken looking at funding of southwestern Sydney local health area. And that study had found 17 recommendations, and the primary one of which was immediate cash injection into this region. This region, the local health area, services the largest population across New South Wales. However, it's one of the lowest funded per head capita. So we're talking about May. 3-4 months later, look at the crisis we're now in. Fairfield Hospital itself has no cancer ward, doesn't have cardiac specialists, doesn't have diabetes specialists, doesn't have chronic health specialists. There's no MRI. It doesn't have electronic medical records. The maternity ward can't provide epidurals. So Fairfield Hospital, which services 200,000 people, is barely an outpost of Liverpool Hospital, which is considered our tertiary hospital. If something goes wrong in the maternity ward, you've got to jump on an ambulance and get carted off to Liverpool. However, Fairfield was labelled as a place where others from different cultures couldn't comply with health orders. We were told we had to be tested every 3 days if we worked outside of the area. Well, what that meant was people waiting till 4 a.m. to be swabbed so they could go to work. There were lines that went for kilometres outside testing centres across the area. And we have to ask why, and I think it's tempting to say, the state government not funding public health services, it's the classic neoliberal lack of funding for social services. But I think the problem goes deeper than that. I think what is evident here is a perpetual crisis of the state. What's the function of the state? And if the function of the state in a crisis is to get us through this crisis, why are we being provided with nothing but hardcore policing, authoritarianism, military in the street? I think the state is really struggling to find legitimacy in the current period. And I think by promising the world that it could stop a pandemic, which it clearly couldn't, it's then manifested in a brutal policing of southwestern Sydney with an other that could be so easily disregarded and thrown to the side. I think I often get asked, what could we do differently? And I think I look to what's happened locally. Dozens and dozens of volunteers locally have really led a response. They've gotten out in the community, a community that has, 70 different language groups. And they've gotten out in this community in a volunteer fashion to help educate and inform the community. The local council has mobilised every resource in its capacity. Imagine a local council that operates a handful of childcare centres, gyms, I think I'm back again. Feel like I am. The local council, which operates a handful of childcare centres, gyms, has pulled every staff it has available to develop a wellbeing register.
Andrew, do you want to try turning your video off again?
And do outreach. Yep. Okay.
Are you there?
Yeah, I'm there.
Yep.
Yep. So I'm speaking of the local council, who's mobilised its scant resources to try and provide some relief to the local community here. They've pulled every staff member that they've got available at their disposal. They've repurposed the gyms and recreation centres to package food for people who are stuck in isolation. The community here has been totally abandoned by the state government, and it's shameful. With regards to a response, I think the response must be community-led. I want to finish with a quote. The quote comes from an unconventional place, and that's TikTok. A gentleman who goes by the name of Yonan333 said the following: "Who do you know from Fairfield who works in an office in the city? We are essential workers. And if you think you can shame us and embarrass us, you will never shame us or embarrass us. We are working class people. We are fair people. We work for our money to feed our families, to feed our kids." And as he was delivering this speech, he was spotting a police helicopter hovering above his house. So I'll leave it there and we'll open up for questions.
Thank you, Andrew. I think all three of our speakers have really hit home about what the need is, about the difficulties people are facing. And I'm hoping that people send their questions in. I've got a few while Pat, who's our administrator, is pulling those questions together for me. So I'll ask a few, unless Pat wants to let me know that there's a lot of them. I'll just put that they're already, he's almost ready. We're running a little ahead of times, which is not a bad thing in a Zoom. I want to ask Heidi and Mira how ratios could make such a difference, nurse to patient ratios. And is there a way that you can use the current situation where nurses and hospital workers generally are getting such good feeling in the community for you, despite Heidi saying that nurses get spat at and kicked and bashed. We know that, but overwhelmingly there's this strong feeling in support of nurses in particular. How do you think that how would you go about harnessing that strength?
It's trying to get the community, like for ratios more so, it's trying to get the community more involved because, like, as I said, we've been campaigning for it for over 10 years. We've had strikes. This is the public sector too, so completely different to private. But so we've had the strikes and walk-offs, the nurses gather and everything. And then, a few years back, we got a thing that the government or New South Wales Health calls nursing hours per patient day. So they allocate, so, and depending on the hospital you're into, if you're in a metro hospital, you obviously need more hours of care than someone in a country hospital because, you know, you're in the city. But basically it's supposed to work, but it does work to the hours that each patient's given, it does work to be given to 4 to 1, but it doesn't work like that. It can be manipulated by management very easily. They won't replace like for like. So if a registered nurse calls in sick, they might replace it with an assistant in nursing who can only practice within her scope. You need the registered nurse on there maybe to do medications and things. They just manipulate it. It doesn't work. It's broken, but they're quite happy with it because, you know, they don't have to give us ratios. So what we're doing to the government, they're not listening. We really do need the community support. When we campaign hard for it, we generally do it around an election, obviously, because we want to put the pressure on the government to, you know, commit to ratios. So that's when we try and get the community involvement to put pressure on them and make them, you know, like that. I'm not on the ratios campaign. I've got another one going at the moment, but basically, yeah, trying to get it out there to community and the support, and then getting on there and writing to their MPs, doing all the usual stuff you do to let them know that they're supporting the nurses, and we get out there on the ground and try and get the message out there. And yeah, we've got I think we've got a good fight. Next one, because of COVID has shown it, and the community, like, you know, we know the government don't really give a crap about what we're going through, but the community really do. And they're really supporting it and going, you know, the nurses have stepped up, and the doctors, they've stepped up. And, you know, the wardsmen, all healthcare services, they've all stepped up. And I think we might be able to use that to keep that community support going, but we just need to tap into more, basically, to get the ratio fight going. And
I think Heidi, yeah, as Heidi said, it's really hard. I mean, the nursing hours, they make sense, but they don't. I mean, you know, even in my 1 to 4, even if I had 1 to 4, 3 of those patients could need so much more time and care because they have the acuity of their illness is higher than maybe one of my patients. And I'm not able to provide that safely, you know, without extra staff. And, you know, and then at the same time, as much as, you know, we want to be there for our patients, you still have families coming at us saying we're not doing everything we can for them. And we are, but we are limited, you know, in what we can do with the limited staff we have.
I've got a question, and you've both answered very clearly and well for everybody, given the level of emotion that you've had to put into your presentations tonight. This is from Nicole to Heidi and Mira. To improve ratios would mean increasing staffing. Are there staff available to fill the roles? If so, why aren't they in there? If not, how do we get them?
With that one, so at the moment, we are experiencing a little bit of a nursing shortage, only for the simple fact that our population grows every year. We need more nurses.
Excuse me, Heidi, could you just speak up a little?
Oh, sorry. So in saying that, we are having a little bit of a nursing staffing shortage at the moment, or so the agencies and that, you know, it's indicated. What's happened is population grows every year, hospitals expand every year, we need more nursing staff every year, and we generally take in a fairly big intake of overseas nurses. We can't get them all in at the moment because of COVID, so we're not getting people in and out a lot. So the overseas nurses pick up a lot of slack. They make up a lot of our numbers when we do need more nursing, plus our new grads coming out of university.
And now
there is staff there. The government just don't want to pay for the extra staff, even though evidence-based research has proven it saves money once you've rolled it out and get it happening, because they save on overtime, sick leave, all those sorts of things, right? So, and it saves lives. It's been proven. It's in Queensland and Victoria. So they got it in and it's working there. And the Queensland evidence-based research came out to prove that it does. Our government's just not listening. They don't care. There is staff, and there would also be, when you go to university and you're a nurse and you're in your first year, you basically go and do your clinical training. You decide whether you're going to stick with it or not. Sometimes when the nurses are doing the student nurses are in, if they're aware that there's multiple jobs to go to and that you're going to have more going to uni training to be nurses, then you've got your AINs that help us out too. There's plenty of AINs out there that can work in hospitals. It doesn't always just have to be an RN or an enrolled nurse. So to make up those numbers or to help out with on the wards, see, we call it specialing within our numbers. So if we have a wandering patient that's not aggressive or anything, just wandering and needs one-to-one, we can actually get an assistant in nursing in, and they will look after that patient, walk with them, keep them safe while we keep doing our work. But we have to do it within our numbers. So we have to look after, you know, 3 or 4 patients that are really sick, falling, need things, and then we've got to chase the wandering one so they don't escape from the ward or the hospital or have a fall or anything like that. But yeah, the staff is there. As much as they might say it's not, it is there. Because if they can get casuals to fill in, and we've got a casual pool, a lot of those casuals are waiting for a full-time job to come up on a ward so they can jump on it. And the agency staff too. So I believe it's there.
I've got a question from Robert, whose partner is assistant in nursing tuning in.
Mm-hmm.
It says, have we heard about the struggles of private hospital ratios of 1 to 6 opposed to the 1 to 3 ratios? It's jumping around 1 to 3.
Oh, 1 to 3 is ED. So 1 to 4 is your standard on the floor for the wards. ICU and that obviously would come in differently due to the acuity. I can answer that so public is completely different. Public comes under New South Wales Health. Even though they've got that nursing hours per patient day that can be manipulated, it is still a baseline. They still can't, I'm an outspoken person. So if I walked into a shift and they said, you've got 9 patients tonight for night shift, I'd say, no, I don't. You're breaching the award. You need to either close 2 beds or get some extra staff up here. But not every nurse does that, right? There's people, so it does still happen. But we've got a baseline to go on that our award backs us up on. Private hospitals, most of them, I think there's only 1 or 2 that have got some sort of a ratio or nursing hours. But most private hospitals, your big ones, like your Healthscope, Healthy Care and Ramsay, they have nothing. There is no ratios whatsoever. They do not have to abide by anything New South Wales Health puts out there. They have their own EBAs, they have their own rules, they have their own policies. They refuse to introduce ratios as well as the government, but they don't even have a 1 to 6. So theirs is a nothing. So basically, that most of the time, 1 to 6 is a good day. So if the nurses go in and they've got 6 patients, that's good. But, I've heard stories where nurses, and these are surgical hospitals too. So private hospitals mainly do surgicals, which a surgical patient, as Mira knows, can deteriorate like that so quickly. They can be stable, and the next minute, if they're a Met call, they need to be taken to ICU. Basically, they'll come onto a ward and they might have 12 patients for a 10 to 12 hour night shift to look after surgical patients. They don't get their breaks. When they try and claim their breaks, they don't get that either. They get refused it. So there's actually no real ratios, so to speak, in private, which we're fighting that as well. So what we do know is that public has obviously got a higher density of union members. So they've got a bit more power with their fights to walk out, protected action, all that sort of stuff. We'll push for it with private. We know we have to get it in public first, and then that kind of paves the way, and we can start trying to get things into the private system as well. Because we have a lower membership density in our privates, we need to build the power there too, which we're in the process of doing. But also, we need to get that up and running. And once the public gets it in, the private nurses can, we'll keep supporting them. We're still fighting for it, but look, every time the new EBA comes up with private, they refuse to put ratios in and discuss staffing because they don't think there's a problem.
Thanks, Heidi. Got a question. There's a couple of questions for Andrew. The first one's from Graham. Are teachers only being offered AZ to avoid being stood down in return to face-to-face teaching?
That's an easy one to reply to. No, in fact, I think there was a rollout of Pfizer that happened some weeks ago. It was specified for teachers in LGAs of concern, as they're so described. And that's been offered in a couple of different rounds. So teachers have had access to Pfizer to some extent. I wouldn't say teachers across the state have had access to Pfizer, but teachers in LGAs of concern have definitely had access to Pfizer. Look, the latest data I've become acquainted with regards to teacher vaccination rates is that it's somewhat higher than the general population at this point, which I guess is, a positive to draw from.
I've got one more question for Andrew, and Then I'd like to hear from Bernadette. This has already been organised beforehand. Bernadette McPhee, whose daughter is facing the same sorts of things as a nurse in Victoria, and it's a bit of a solidarity explaining what people are facing there, not just up here, of course. But Andrew, first off, the far right, epitomised by Clive Palmer and Murdoch and his Sky mob, are deliberate, manipulating and have been on the front foot, encouraging the so-called freedom protests. What's your response to those taking part? How do we heal this deliberately sown division?
It's a complex question, Lindy, I really do believe. And I think, you know, my take on that, particularly the large rally that took place in Sydney in August, featured a lot of people from southwestern Sydney. There's no question about that. And they were people who were without employment, who had experienced a brunt of the over-policing, and were, in many respects, quite organic in their protestations at the very beginning. I mean, there were little sort of manifestations in Bankstown and other locales of resistance to the public health orders that were deeply unfair. I think it's complicated in the sense that I don't think there's a natural alliance between the far right and the working class. I think that what it really demonstrates to me is there's a massive poverty in the so-called left, in its ability to reach out and connect with working class and multicultural communities, to be frank. I think decades of erosion of social institutions, which we would have anticipated would provide leadership in moments like this, have really come to bear upon all of us. You know, for me, it's been a massive wake-up call. The first opportunity I get, I will be trying to generate some sort of community-based forum in Fairfield to draw some lessons that can develop a collectivist response that advances the needs and requirements of the working class in this area. I think that's really critical. I think that our absence in this space has meant that we've left this community entirely vulnerable and preyed upon this nonsense messaging around so-called freedoms. So that's a real concern. And I just wanted to sort of add perhaps this notion that there's not enough money around to adequately fund hospitals, or in my case, the schools. I can only hazard a guess at what it costs in terms of the policing operation that's currently taking place in this state. Keeping that helicopter over southwestern Sydney 24/7 essentially is alone tens of thousands of dollars a day. Okay? An incident breaks out, and people have seen this on social media, where somebody gets harassed and arrested around a perceived public health order breach. And before you know it, you've got 40 or 50 police surrounding that person. I mean, that is just remarkable, right? So what is that costing per day? I bet that police overtime hours are through the roof, and the bill here is going to be huge in terms of the policing. And so I'm just not buying it that there's no money for public health or public education for that matter. That's just absolute bullshit. It's a question of priorities, and clearly they've policed their way through this pandemic, and we've heard enough, I think, you know, to evidence that from the healthcare professionals in our midst today, to show us what that actually means on the ground. So I just wanted to throw that in as well, Lindy.
Fantastic, well said. Good to hear a class analysis. It's because that's at the heart of what's going on here, isn't it? Can we get Hillary up to speak for a couple of minutes, please, Pat?
Sorry, Bernadette's here. I just dropped out.
Oh, Bernadette. There's a Hillary McPhee, who's a book publisher, and I've confused you, Bernadette. Sorry.
I'm so sorry. I've got... Oh, okay. Sorry, I just dropped out. Look, thank you for allowing me to speak. And first of all, I'd like to acknowledge that I am on the lands of the Wurundjeri people of the Kulin Nation, and I pay my respects to the elders past and present. Tonight, I'm speaking just as a retired nurse and midwife and as a mother of a daughter who is a critically care trained nurse working in one of Melbourne's major emergency departments. And coincidentally, one of her best friends has just written an open letter to Dan Andrews, and I will share that with you in the link later on, and it's a petition. But what she says is, I write to you completely deflated and empty, not sure where else to go. This is addressed to Dan Andrews. I've been trying to think of a way to have my voice heard, and this is what I've come up with. I'm a critically care registered nurse from one of Melbourne's busiest emergency departments. As you are aware, we are in a terrifying health crisis, the most terrifying aspect of which is a nursing shortage. This week, I entered my 6th night shift in a row. I walked into work and burst into tears. I took myself to the toilet, hoping no one would hear me. I've always been resilient, but this pandemic has broken me and most of my colleagues. I'm not here to criticise. And she goes on. Then she later goes on to say, we are being asked to team nurse. In short, our staffing situation is so dire that we are being asked to team lead a group of nurses and undergraduate nurses, delegating them the task, all while each patient, 9 of them, are in our sole responsibility. This week I suffered my first ever migraine because I have not got readily available access to water while on shift. I do doff the PPE, leave the department and take water breaks, something I assure you is not easy when sick patients rely on you. And it goes on. And, you know, and we have got better staff to patient ratios here in Melbourne. However, we have a critical shortage of nurses. And I'll just read a text message that my daughter got from the ED department this morning, and solidarity with, you know, Heidi and Mira. It really is really bad. Dear ED nurses, as you are all aware, we're experiencing a large nursing shortage across all shifts. This has recently been made worse with the need to redeploy nurses who don't meet the strict criteria of being 12 days post-double vaccination to work in the ED. So those that have done the right thing are picking up the work for the people that have been irresponsible not getting vaccinated. I firmly believe, as a retired nurse and midwife, that every person working in any healthcare setting in any form should be mandatory to be vaccinated. Anyway, so the text goes on. The text goes on asking them to do extra shifts, double shifts, overtime, short shifts, disco shifts, and it goes on. Well, my daughter, I've told my daughter, no, you're not, because she is on the verge of a breakdown. She has already sort of had a mini one at work. The nurses are crying to and from work. They will ring. I've had my daughter call me on the way to work, hyperventilating. She's had to actually slow her breathing down to, you know, I've had to talk her through just walking in the door of an emergency department. So we are in a shocking public health crisis. I think I read in May last year that Josh Frydenberg has taken out $23 million out of the Victorian public health system. So, you know, and I just find myself as a mum, retired nurse midwife, I'm caring for the carer. Heidi, my heart goes out to you if you were on your own. We actually, our daughter was actually at home last year, and because we've been doing this for 18 months here in Melbourne, the nurses are really exhausted. I think during the 2nd or 3rd lockdown, when we went into our major lockdown that went for months, I actually spoke to my daughter after she had moved out because she was worried about the fact that she was going to come home and infect her family of 7 of us. She moved out. I said, please come home. I would rather have been home than have been on her own. Anyway, that's life. Thank you all.
Bernadette, thanks for that. I'm just, oops, am I unmuted? Yes. I've got a question for Andrew. From Kay McQueen? What is the New South Wales Teachers Federation doing to support teachers in Fairfield and Liverpool and negotiating in terms of conditions during the pandemic?
Thanks for the question, Comrade Kelvin. Long time no see. Yeah, look, I think there's a few dimensions to answering that question. I think the first one is that the Federation, I think, was successful in accessing Pfizer for LGAs of concern, which I think is quite important and quite reassuring for a lot of the teachers that I work with, at least. If I can speak from the ground as their Federation representative. I said, additional to that, I think Federation's strong resistance of the government's attempt of a premature return, I think, has been critical in resisting Gladys's desire to have the HSC go ahead as if it's some panacea, and some sort of rescue moment and evidence of her strong woman capacity to manhandle a pandemic. I think that's been really important. The Federation was able to hold that line and unite around that. I think more specifically, I think it's been difficult. Look, for the most part, schools in this part of Sydney just have not really had students attending. Okay, some primary schools have had very, very minor attendance, but I would argue that, from my understanding, most secondary schools, you're lucky if you've got 1 or 2 kids on site on a given day early in the term, and that sort of just whittled down to nothing, which is sensible and I guess also reflective of the community's response. So that's how I predominantly answer that question. I think it leads into a broader question that I think is worth considering as we move forward together. And I think what's apparent to me is that there's a natural potential for an alliance emerging between teachers and nurses around this moment. And I think that both of our unions probably don't make enough of that. And I think that more needs to be made where possible, because, in many respects, if I sort of reflect on my team's experience, I've been supervising a learning and support team at my school, and our responsibility has been to contact disengaged learners at our school. And so we kind of deal with the social impact of what we're hearing from the healthcare professionals. Every day I get reports from my team of another family that's gone down as all positive. And we have to wrap around that family and that household and sort of do social outreach. It's not even teaching at that point. It's really, frontline wellbeing care for young children. Which is really hard and really draining on those teachers and learning support learners and teachers' aides. And I think that there's a natural alliance there. I mean, we've essentially been abandoned in this moment by the state government. I would like to hopefully advance a conversation at some point, perhaps not tonight, of where there is an organic relationship between teachers and nurses around this moment that could be taken advantage of and exploited to really press the state government, because I think that they're a lot weaker than they perhaps appear on the surface. So I've gone off on a tangent, Kelvin, but I'm sure that you'll indulge that.
Thanks, Andrew. Look, we are really close to the end of our time and we've got a lot of questions. Andrew Gold from the AEU South Australia asked, what's been the impact, your experience of the impact on students and staff? I think you've answered a tiny bit of that, but just very, very quickly, could you answer that one? Yeah,
I can. Look, teachers have hit the wall this term, there's no question about it. It's impossible really to imagine how you could teach readily under the current conditions. Teachers are trying to run online learning. At a school like mine, a third of the kids don't have the capacities to learn online, so we are compiling and giving access to 300 book packs a fortnight so kids can do learning from home. That requires my learning and support team to make thousands of phone calls this term to arrange for the collection of those book packs. We've lost contact with kids who are high risk. We get wellbeing concerns delivered to us by the phone, and then we're having to do mandatory reporting around that, and everything is late and hard. As I've said, we've had community members in our school community who have passed away, unfortunately. We've had parents pass away, and the burden is immense. And I think that the recovery from this moment will take many, many months. And I don't imagine it's as simple as kids returning next term sometime and everything being okay. It will take a long time for us to recover. So, I mean, that's in a nutshell, I think, the impact.
I think we've got some more questions. I don't think we're going to get able to get to them. I know we can't, but if we could perhaps, I'm not sure how, if there's a possibility of people emailing those questions to Spirit of Eureka at aim.eureka@gmail.com. We'll put those details up with our, I'm just about to move to the open letter, and maybe Pat, you could put that open letter up, because it's a bit weighty, a bit large, and people who haven't seen it might like to have a look at it just while I mumble on in the background. This is going to be available tomorrow on the Spirit of Eureka website. And this time, a lot of people will have seen it, but this time it's got signatures to it. There will be, we hope, more signatures. We know there's been a proliferation of open letters. A notable one is the one by the Business Council of Australia. I mean, they have the open ear of government at all times, and just something. So I think ours, although it's not perfect, was looking at a situation where the far right corporations were organising, and we weren't able to be in that space. And so we've just put our toe in the water, first with that statement. Now, this is the first of our Zooms. We've been criticised a bit by a couple of people about sending the letter to the federal politicians, to governments, but it's been so when we're hearing from people like Andrew of what was happening in Western Sydney, when we were hearing from nurses who are our members about what was happening, it really became quite urgent that we started to do something. And if you think of the money that's not available that we've heard about tonight, well, we've always got money for war. Billions and billions and hundreds of billions. And on today, of course, the announcement of a whole new lot of nuclear-powered submarines that is going to put us absolutely under US control, because they have no role apart from an aggressive war locked in with another big power, and the only obvious one is the United States. So I think one of the things that we looked at, we saw a disaster unfolding here in front of our eyes, and we decided to act. We saw community, be it workers organising, neighbours helping each other, Addison Road Community Centre in Marrickville delivering more food to those that need it than any other organisation in Sydney, including those with dozens of big corporate sponsors. We know community of that type is the way forward. On Thursday, two weeks from today, 30th of September, our next forum will be looking at what's happening in prisons in this COVID time, what's happening to First Peoples in prisons, and what to do about it. We'll have Barrister Greg Barnes from the Australian Lawyers Alliance and prominent Gomeroi activist Gwenda Stanley to be our speakers. Look out for it. Thank you for joining us tonight. We hope you can take a few minutes to read the open letter if you haven't already done so. Down the bottom in small letters, very small printing, are all the people who've signed so far, and we really thank them. Thank you, everybody. Thank you particularly to our speakers, and thank you to Pat, who's been in the background organising the whole background bit of it. And we hope to see you in 2 weeks. Email your questions to us if you can, and we'll attempt to get some answers for you as soon as we can. Thank you, everybody.
Thanks a lot, Lindy. Thanks, everyone, for listening.
Thank you.
Bye.